Welcome to each one of you, and thank you for taking time out to catch us live. SixSox Minds is here to serve, share experiences, learn, and reach beyond. Today, we bring to you our first SixSox Saturday Showcase. Showcase is a platform that brings in unique speakers, apart from those in-house, to deliver on unique topics. At this juncture, I'd like to call in our in-house specialist, Hariharan Iyer, to introduce our specialist speaker.
Thank you very much, Deepa. Ladies and gentlemen, wish you all a good afternoon. Today, our speaker is Dr. Kaiser Raja. Dr. Kaiser Raja is a consultant in gastroenterology and liver disease at the King's College Hospital, London, in Dubai, United Arab Emirates. He is also specifically trained in liver transplantation, can evaluate patients for transplant, and can provide post-transplant medical care to patients. His area of expertise also include endoscopy, management of liver cancer, and chronic pancreatitis. Let us welcome Dr. Kaiser Raja for his talk titled, Your Liver Matters.
Good afternoon, everyone. Thank you, Mr. Hariharan, for your kind words of introduction. At the foremost, I would like to heartfully thank the SixSox Minds team for giving me an opportunity to be their first speaker for this series or set of meetings. And I would like to today talk on something very simple. I have put liver disease in a simple manner for the common person, and I hope all of you are able to understand the thoughts which I'm going to put across. So basically, the topic for today is Your Liver Matters. So we're going to essentially talk to you in a very simple form about liver disease. I mean, liver disease is a huge field, but there are a few essential things what common people who are not at all connected to the medical field should know about the liver. You all know a lot about heart disease, diabetes, joint pains, cholesterol, but I believe that knowledge of liver, the basics of liver, is not very well known. And there are a lot of myths about liver disease, which are quite prevalent even in the kind of the educated world. So when it comes to why does the liver matter, we must understand that why is the liver so important for us? Well, as with any other organ, liver is also an important organ with many functions. Here I would like to tell you that the liver does more functions than any other organ in the body. If you compare it with the heart is essentially a pump. Well, it's very important. I wouldn't say it's not important, but basically it's one function, which is to receive blood and pump it. The kidney is a filter. It receives blood, filters all the toxins, and returns the blood back to the body. On the other hand, liver is a much more complex organ with many, many functions. We'll talk about these functions in a while later. Now, why the liver is also important is because about 1 in 25 individuals has a significant liver disease. So about 3 to 4% of the population has a significant liver disease, and the majority of them are not aware of this because they don't have any specific symptom of liver disease. And then whenever we talk about alcohol, well, alcohol is prevalent in society. There's no going away from that fact. And we all know that alcohol has a damaging effect of liver. And so I'm sure a lot of you would be wanting to know, how is alcohol really connected to liver? What is the amount of alcohol which can be safely consumed by an individual? And what are the limits beyond which alcohol becomes damaging to the liver? I'm not sure how many of you are aware that our modern lifestyle, which includes our diet, which is high in fat, high in carbohydrates, our sedentary lifestyle, which has actually led to people who are overweight. These factors also damage the liver. Now, another thing important to remember is that liver is a silent sufferer. I told you 3% of the population suffers from liver disease, but many of them don't have symptoms. And this is because the liver needs to be damaged to almost 80% before it starts producing any symptoms. The most important thing is that liver disease is, after all, preventable. So if we know the basics, then we can prevent liver disease. Now, this is where the liver is located. So liver is not exactly located inside your belly or abdomen. It's actually in the lower part of the chest. It's nicely safeguarded from the from injury by the ribs on the right side. Liver is vital to survival. Why? Because it does many functions. I told you it does functions more than any other organ in the body. It helps in production of a chemical called bile, which helps in digestion, especially digestion of fats. So when you have a serious liver problem, it's the digestion of fats which can become a problem. When you eat anything, this food is broken down into smaller components. After digestion, these smaller components, they might be fat components or amino acids or carbohydrates. They all go to the liver where it is further metabolized and energy is produced. And it is important to remember that when you are fasting, for example, prolonged fasting during Ramadan, or at night when you're not eating, what keeps producing energy for your whole body? It's the liver. There is glucose, which is stored in the form of glycogen, and this gets, energy is produced from this stored glucose in the liver. Liver also filters harmful substances. So it's in addition to kidney, liver also acts as a filter. Liver helps in production of antibodies. So when any bug tries to enter the human body, especially through your gut, it has to pass through the liver. The liver recognizes these bugs and produces antibodies which help in fighting infection. One thing which you may not know is blood clotting. When you get a cut, let's say on the skin, you would bleed a little and then it would stop. What stops the bleeding? There are clotting factors in the blood which help prevent bleeding. And these clotting factors are produced in the liver. So once you have liver problem, your blood does not clot and you can have excessive bleeding, maybe from the skin or the teeth or the gums or from internal organs. Liver is also a storage organ for blood, for vitamins, cholesterol, and carbohydrates. Now, this is what people would want to know. How do I know I have a liver disease? I'm a healthy person. I eat well. I'm a little bit overweight. Apart from that, no other issues. One has to remember that liver disease is usually silent. It does not really produce any specific symptom. Symptoms occur only when you have advanced liver disease. And I told you symptoms occur when 80% of your liver is damaged. Having said that, there are some common symptoms of liver disease. For example, loss of appetite, fatigue, nausea, weakness, weight loss. Sometimes some liver disease is called bad itching of the skin. But again, these are so common symptoms. They can happen with so many diseases. So it's difficult to say that everyone, let's say with fatigue, has liver disease. It's important to remember that if you have one of these symptoms which is persistent, not going away, it is important to keep in mind that you may be suffering from liver disease. There are other symptoms which happen when your liver is significantly damaged, and then you get something called jaundice. I'm not sure how many of you have heard this word, but it's basically the yellowness of the eyes. Your eyes, which are generally white in color, become yellow, and this is called jaundice. You may also have dark urine and pale colored stools. This is what jaundiced eyes looks like. It looks yellow, and this is sometimes the first symptom of liver disease for people who have never had a liver problem. This might be the first sign which they notice, which makes them go to a doctor. So what is this jaundice? So jaundice itself is not a disease. It reflects that you might have a liver problem. It is due to increase in the level of something called bilirubin. Bilirubin is produced by the liver. And when the levels of bilirubin increases in the blood, your eyes get yellow. Your urine becomes darker. So this is what jaundice is. But at the same time, it's important to remember, every patient with jaundice does not have liver disease. Jaundice can happen because of many other reasons. It can happen because of problems in the blood. It can happen because of stones in the gallbladder. It can happen because of pancreatic problems. So jaundice can occur because of diseases other than the liver, although liver is the most important cause of jaundice. So when you have jaundice, you must not reach a conclusion you have liver disease. Well, most likely you have, but it's extremely important to diagnose what exactly is causing the jaundice. Now, before we go into the common causes of liver disease, it's important to understand that there can be many types or many different ways in which your liver can be affected. A common thing which some of you might have suffered from or might have heard a family member or a friend suffering from is something called acute liver disease or acute hepatitis. Let's say you travel. I know travel is difficult in what we are going through nowadays, but let's say you travel, you go to Asia, Central Asia, Africa, you travel, you come back, you get sick, little fever, some nausea, vomiting, and then your eyes get yellow. You reach a doctor or a clinic and they tell you you have jaundice. So what have you developed? You have developed a condition called acute hepatitis. It is because usually of an infection. There are viral infections that affect the liver. You might have had something in the food which went wrong. There might be some drugs or toxins which affect the liver. For example, people take hormones and certain special supplements for bodybuilding, and some of them are toxic to the liver. Some of the medications which doctors give are toxic to the liver. So a short-lasting disease which due to an acute injury to the liver is called acute hepatitis. This causes symptoms, but the good thing is that recovery is usually complete because actually your underlying liver is normal. Then you have something called chronic liver disease, which we'll discuss today. This is something which is damaging your liver for years. For example, you're drinking alcohol for several years. So this is chronic damage to the liver and you develop chronic liver disease. This is a dangerous thing to have because you may have no symptoms while your liver damage might be ongoing. Once you have chronic liver disease ongoing for several years, you reach a condition called liver cirrhosis, which is the end result of any form of long-standing liver damage. And this progresses to liver failure, where you start giving severe symptoms, and it's a life-threatening condition, and you might then reach a stage where you might need a liver transplant. And these people who have advanced liver disease are the ones, the minority, who might actually also develop liver cancer. Of course, we're not going to discuss these severe forms of liver disease. We're mainly going to concentrate on people who have chronic liver disease going on without their knowledge. They don't know about it. So we're going to tell you things which will help you recognize that you might be suffering from one of these chronic liver diseases and you can seek medical attention. This is just to show you what a normal liver looks like. So this is a normal liver. As you can see, it is smooth, it's even, it's not nodular, it's soft to touch. And when you get cirrhosis, which is the last form of liver disease, your liver becomes hard, nodular. You see the surface gets irregular and the liver then shrinks also. So this is liver cirrhosis, the end stage of all chronic liver disease. Once you reach this stage, it's irreversible. And then there's a progressive downhill course and there is serious trouble. Now, we're going to discuss what can lead to chronic liver disease or cirrhosis. So there are, of course, many diseases which can cause cirrhosis, but the common ones are alcohol, something called fatty liver disease, which is very common in fact, and very briefly about some viruses which affect the liver, hepatitis B and C, which will come to the end. Let's start with alcohol. It's a very important problem. Whenever someone has liver disease, it is presumed that this person must have been drinking alcohol. That's why livers got damaged. So people connect alcohol with liver, as if everyone who drinks alcohol has liver problem and everyone who has liver problem is probably drinking alcohol. So all said and done, alcohol is a toxin that damages the liver. But just like any other toxin, the liver has got a limit to metabolize alcohol. So if you drink alcohol within certain limits, and we'll come to what those limits are, the liver can break down or metabolize that small amount of alcohol and you may not develop liver damage. But if you drink alcohol in excess, more than your liver can process, then you can expect serious liver damage to happen. Interesting thing, alcohol can cause up to 500,000 deaths annually across the world. So it's a big killer. And overall, alcohol addiction reduces life expectancy by 10 years. Also, addiction to alcohol is genetically determined. So if you are a heavy alcoholic, there is more likelihood that your children would also get dependent or addicted to alcohol. Now, this is a slide which most of you would be interested in, especially the ones who drink alcohol. How much alcohol is recommended? So there have been studies, well-conducted studies all over the world. And the net conclusion is that small amount of alcohol is actually not harmful to the liver. So how do we define what is this small amount of alcohol? So whenever we talk about alcohol intake, in medical terms, we talk about units of alcohol. 1 unit of alcohol is 10 ml of pure alcohol. So you can say if wine is 10% alcohol, 100 ml of wine is 10 ml of alcohol. If beer is 4% alcohol, 250 ml of beer is 10 ml of alcohol. Similarly, spirits, vodka, whiskey, if it is 40% alcohol, 25 ml is 1 unit of alcohol. So generally, you could have 6 pints of beer every week, or 7 glasses of wine every week, or 14 single shots of spirits. So that's the limit. If you drink beyond that, then it becomes overboard, and then at that point, your liver can get damaged. But the interesting thing to remember is that these limits are for healthy people, people who are not diabetic, people who are not overweight. So if you have diabetes and overweight, and you'll understand after a few more slides why this slide is there, diabetes and being overweight itself cause liver disease. So one thing is already causing liver disease, and on top of it, you add alcohol. So if this combination is there, then your risk of progressive liver damage is much, much higher, even with those small amounts of daily alcohol intake. Now you might have questions. I drink alcohol, I'm healthy. So do I have liver disease? Well, you must remember that most individuals do not have any specific symptoms of liver disease. When I say most alcoholics do not have any specific symptoms of liver disease until your liver disease is advanced. If you see this graphic on the right-hand side, this is a healthy liver. You keep on drinking alcohol, you start accumulating fat in the liver, what we call hepatic steatosis, or simply fatty liver. This really does not cause any symptoms. The liver gets big in size, and that's all. If you stop drinking alcohol, this will reverse. If you don't stop drinking alcohol, this stage will progress to something called liver fibrosis and to liver cirrhosis, which I have told you. At this stage, you start getting symptoms. Some unfortunate people drink so much alcohol that apart from developing fat in the liver, they actually get serious inflammation in the liver. So they present with jaundice, they present with fever, vomiting, swelling of the feet, and they have a serious condition called alcoholic hepatitis. If they stop alcohol, they can still go back and achieve a healthy liver. But if they don't stop, they can actually die or then progress to cirrhosis. Once you progress to cirrhosis, you can then present with weight loss, loss of appetite, a general deterioration in health. You lose your muscle mass. You'll have swelling of your feet, swelling of your belly. Some people get periodic episodes of confusion, and you can actually present with serious problems like vomiting of blood. But again, remember, all this happens when either you have severe alcoholic injury or cirrhosis. In the vast majority of people who drink alcohol, they might be having just fatty liver, alcoholic fatty liver, without really having any symptoms. How to get evaluated? So this is for alcoholics. Well, they have decided that we need some evaluation. How to go about it? Don't assume this. I have no problems, no symptom. I drink alcohol, I'm healthy, my liver should be fine. It's not so. If you have been drinking alcohol more than specified limits for more than 5 years, you may have liver disease. That you should keep in mind. You could do a blood test to check for liver function, but remember, liver function tests are not very reliable. These blood tests just tell you a gross idea of what's happening. You might have normal liver function and still have liver damage. You can have an ultrasound scan done, which will look at how much fat is there in the liver, is your liver enlarged? But again, it will not tell you whether you have just simple fat in the liver or advanced liver disease. So we have some new techniques. Of course, there are some specialized blood tests which can tell you, but this is new technique which is very popular. And if you go to a liver doctor, you'll probably land up getting one of these. That's why I put up this slide. This is called FibroScan. And this machine actually tells you, it's based on an ultrasound technology, whether your liver is soft or firm or hard. So simply putting it, if you have a soft liver, you have a good liver. If you've got a firm or hard liver, you've got a bad liver. So by doing a simple test, you can find out whether you got a good liver or a bad liver. And you can see this lady is doing an ultrasound scan on another lady who's suspected of liver disease. It's a very simple bedside test, doesn't cause any pain, and takes about 5 minutes to do it. It gives you a score. So as you can see, it gives you a score 2.5, 7.5. It can go up to 40. Lower the score, better it is. So any score below 7.5, that means your liver is good. And any score above that, and as it keeps on going up, you have more and more advanced forms of liver disease. And the good thing is that, let's say alcoholic patient has a high score. He fortunately decides to stop alcohol. He can repeat the test after 6 months or 1 year. Score goes down. It says that you're getting better. Now let's come to something called fatty liver. Remember, alcohol also causes fatty liver, but a bigger cause of fatty liver nowadays is something called non-alcoholic fatty liver. It's not that it happens in non-alcoholics. It's just that fatty liver can happen in people who don't drink alcohol also. So essentially, it's accumulation of excess fat in the liver. Excess fat causes inflammation, swelling in the liver, and again can cause progressive liver damage and lead to cirrhosis. The interesting thing is that 30% of people who are there on this webinar today are having fatty liver. So this is a worldwide figure. 1/3 of the world population has fatty liver. And 1/4 of these people who have fatty liver will have a progressive form in which the liver will get damaged. So essentially, out of the whole group of people with fatty liver disease, 75% will have only fatty liver and they will not progress. 25% will have certain things which will make them progress to further advanced form of liver disease. So which means that if you have fatty liver, you need to decide whether you are in the 75% safe group or the 25% risky group. And especially if you've got diabetes, you are overweight, you have high blood pressure, you've got high cholesterol in your blood, heart disease, these all go together. So all these diseases go together with fatty liver. This whole complex is called metabolic syndrome. If you have one, you can have the other. So apart from being obese, apart from having diabetes, if you have high cholesterol, all these things cause fatty liver. There is a genetic tendency. So not every diabetic will have serious form of fatty liver disease. So there are certain people who have got a family history of liver disease. And now we've got special blood tests to find out whether you can have a genetic tendency towards liver disease. Interestingly, if you lose excessive weight fairly quickly, so if you decide to do on a diet or an exercise schedule, lose 20 kilos weight in 1 month time, it's difficult to do it. But let's say you're successful in doing it, you can still develop serious fatty liver. So rapid weight loss is also a cause of fatty liver. Certain medications can cause fatty liver. So fatty liver does not mean just having diabetes and being overweight. If you have fatty liver, you need to know why you're having fatty liver. Again, same question, do you have fatty liver? So ask this question to yours, to all of you can look at this and decide whether you have fatty liver. Are you overweight, especially if your body mass index? I'm sure you know what's body mass index. It's a ratio between your height and weight. If your body mass index is more than 30, if you have diabetes, if you have a combination of, let's say, high blood pressure, cholesterol, heart disease, you may not be overweight, but you might just have an abdominal obesity, a big belly and a sedentary lifestyle, you're prone to fatty liver disease. Or you might have had an ultrasound scan for some other reason, and it would have shown a liver enlargement, which might mean fatty liver. Or you might have had a blood test done for some reason, and it would have shown just very mild liver function abnormalities. And actually your doctor would have told you nothing to worry, but still beware, you still might be having liver disease, which has gone ignored. So the bottom line is that fatty liver will not give you any symptoms. Only way to know is to get tested. This again has got several steps. So you start with a healthy liver, you get only fat in the liver, which is reversible. If it keeps on going on, you get inflammation in the liver, what we call steatohepatitis. It is still reversible. But once it starts getting even beyond that, this whole process takes about 30, 40 years. So if you are overweight at the age of 30 years, you will have no symptoms till you become 60 years. Over 30 years, you will reach from this stage 1 to stage 4, which is the irreversible stage. So what further needs to be done? Let's say you have fatty liver, you've been told nothing to worry, but you still want to investigate further. It's important to make sure there's no other reason for liver disease. So you might be a diabetic, you might overweight, but you might be drinking alcohol. So there might be 2 reasons for liver disease. Initial ultrasound scans and blood tests are important, but remember, they give you very basic information. What is more important to know is that what is the stage of liver disease? Among those 4 stages, where are you? How much liver is damaged? Remember, symptoms will not tell you anything. So two people who have no symptoms might be having different stages of liver disease. Second thing you need to know, is this liver disease reversible or is it progressive? And whether you need some specific treatment, some specific medications for this liver disease. So the most important thing, whether you got simple liver disease or advanced liver disease, this is the single most important thing to know. Apart from certain special blood tests, we can do some things in the clinic when you come to us. Based on your age, body weight, diabetes, other risk factors like cholesterol, blood tests, we have certain mathematical scoring systems, which are not very accurate, but still we can put you in one basket, the safe basket or the risky basket. And of course, don't forget, we have excellent technology, FibroScan, which I showed you, which can tell you whether your liver is soft. Remember, soft liver is good liver, firm liver is a bad liver. Now, before we end, briefly about viruses. This often gets ignored. People have subtle liver problems and they've never checked for viruses. So there are 2 common viruses, hepatitis B and C. These are prevalent in certain parts of the world. Let's say Egypt, North India, Pakistan, Southeast Asia, Japan. Viruses are common. In general, anyone can be affected by viral hepatitis. Rough prevalence is about 1%. Usually people are asymptomatic, no symptoms, and they're detected by chance, visa medical. I saw a lady today morning, premarital screening, and she was found to be positive. One may not have symptoms until detected. So it's important to check for viral infections. If you have any suspicion of liver disease, I would suggest everyone should check at least once in his lifetime. Because the thing is that if you have viral infections in the liver, they will go on, and you will get symptoms only of advanced liver disease. And both these viruses are eminently treatable. In the end, how to keep the liver healthy? So I'm sure you've understood by this time, you need to maintain your body weight. You should lose excess weight. You must avoid a sedentary lifestyle. You must avoid abdominal obesity, avoid fatty food, excess carbohydrates, in essential a healthy lifestyle. This is something similar to what your diabetes doctor will tell you or your heart doctor will tell you. Of course, limit the amount of alcohol you drink. Don't take unnecessary medications, even high-dose vitamins. For example, high-dose vitamin A is toxic to the liver. And many of the medications which you take have got various other constituents which are not always there on the label, which can affect the liver. So don't take unnecessary medications, whether they are simple vitamins or even herbal medications. We don't know what can cause what. Always test for hepatitis B and C at least once in your lifetime, and make sure whether you are at a risk category for fatty liver. Control diabetes well, and if you have any doubt, you must get proper counseling from a liver specialist. Now, there are certain myths about liver disease. You can say, I am taking a herbal supplement or certain liver protectives because I have certain problem. Maybe I'm overweight, I have fatty liver, or I drink alcohol, but I'm taking a liver protective, so my liver will remain in good condition. This is false. There is nothing called a liver protective. There is no medicine which has been invented which can protect your liver. These are just advertising stunts. Believe me, there is no proof despite years that these medicines have been available in the market. You can name it and I can tell you it will not work. Other myth, I drink alcohol. I have no symptoms. Why should I have liver disease? I told you, most alcoholics, if they have liver disease, they will have no symptoms. You need to get tested. You need the special tests. You need the fibroscan. I am diabetic and obese. My ultrasound showed fatty liver. Liver function tests were normal. My doctor told me not to worry about my liver. Well, most likely you should not because you might have been the 75%. But still, you must be sure. You must have asked your doctor. Doctor agreed. What is the stage of my liver disease? How did you find out that I got mild liver disease? What makes you so sure I don't have advanced liver disease? Have you had any specialized testing? You must make sure. Another very important myth, people come to us. I have digestive issues. I have gas problem. I can't digest food. I can't eat fatty foods. I have a weak liver. Again, although the liver makes bile, which helps in digestion, the connection between digestion and liver is not so straightforward. Most people who have digestive issues have other issues, gut issues. They don't have liver issues. Your liver will keep on producing enough bile till it's 80% damage. So a simple digestive issue is not a weak liver. Okay, it will at least help you seek medical attention, but at least the thought in your mind that digestive issues are because of liver is a wrong thought. Another thing, the liver never hurts you. I have severe pain on the right hand side of my abdomen because of my liver. Well, actually it could be gallbladder or an ulcer. It's generally not the liver. Liver diseases are not painful. They can produce little discomfort, but never real pain. So I would like to end that recognize liver disease before it's too late, because symptoms will not tell you whether you have liver disease or not. You need to get checked if you have a risk factor. So it's important to understand whether you have a risk factor for liver disease rather than a symptom of liver disease. Thank you very much. I will be happy to take questions, but I would like to hand over the screen to Mr. Hariharan, who can take it forward from there. Thank you very much.